everybody, and welcome to Functional Medicine with me, Dr. Howard Robbins. This show is dedicated to giving you safe and hopefully very effective ways at dealing with various medical problems. Today, this show is dedicated to the eye. I like to call it The Eyes Have It. Okay. We're going to be talking about diabetic retinopathy, glaucoma, macular degeneration, wet and dry eye, floaters, conjunctivitis, and even a case of arterial circulation blockage from a mini stroke, actually, kind of situation causing blindness. And we've seen some amazing results in helping with all these common conditions. As you can see, I can't fix presbyopia. The fact that as I'm aging, I'm 77 right now at the time of this filming, the retina, the lens doesn't bend the way it used to. So I need more light to see well, or I wear glasses for up close nearsightedness and distance, farsightedness vision. So that's one thing I can't fix, apparently. Maybe there's other ways of fixing it, but I haven't come across anything that seems to really work. Before we get into the show, it's going to be very important that you get a pen and paper ready, because you're going to want to write some of this stuff down. It's very important. Otherwise, you're going to have to go back, listen again, and start, stop, and everything else. So first, very important, as you're going to learn, I want to thank my sponsor. I have two sponsors, really. One is PromoLife. You can contact PromoLife at promolife.com. Okay, promolife.com. PromoLife for the eyes is going to sell you an medical ozone generator to do rectal insufflation at home. That's an ozone enema, and it's very comfortable. You can listen to my show on home care ozone therapy, and it goes over details of that. In addition, they have a lot of videos and a lot of support around home care ozone therapy. That's not the only thing you can do with it, but it's going to be very valuable to do for your eyes in the prevention of a lot of problems. Once you have them, you're going to learn about intravenous ozone therapy in a few minutes. You're also going to learn about the gut-eye axis and why my other sponsor, Doctor's Biome, is so important. Doctor's Biome is a very special probiotic beverage, and you can go to doctorsbiome.com. That's DOCTORSBIOME.com. Doctors all spelled out. Doctorsbiome.com. And you're going to get yourself a month's supply of Doctor's Biome Gut Health, and you're going to learn why the gut connects to the eye. The gut biome communicates with the eye, but we're going to be talking about that in a few minutes. And if you use the coupon code Howard35, you're going to get 10% off the retail price of Doctor's Biome. So it'd be very valuable for you to do to write this down and get hold of it as you're going to learn. So let's get started with the show. There's a lot of serious eye problems that, believe it or not, in traditional medicine, they don't really have much help for. And yet, other than pharmaceuticals, if they can be beneficial. And yet, we have natural ways of approaching these things that can make major difference in either prevention or in the actual treatment of them. So let's begin with diabetic retinopathy. I tell all diabetic patients, if you want to fix any diabetic problem, you have to get your sugar in ideal control. We've done shows on diabetes. It's essential. It's not a choice. And if you're not willing to do whatever it takes, and I don't care if it takes insulin or diet alone or both, you have to get your sugar in perfect control. If you can get your sugar in ideal control, then you can help in the prevention as well as in the reversal of diabetic retinopathy. Also, keep in mind with all the things I'm going to tell you, prevention is essential, but now many of the people listening to this show already have these problems. And what we're going to look to do is A, improve them, goal 1, and goal 2, turn them around, possibly eliminate them permanently, completely, once and for all. So the first thing with diabetic retinopathy, you got to get your sugar in control. Then you're going to learn about, because I'm going to give it to you in a group, all the other things that we can do. Please excuse me for being itchy. Glaucoma, where the intraocular eye pressure is high. Now, it's important when you learn about all the things that we're going to be telling you, you have to watch out with glaucoma because many people are already on medication for it. So prevention is one thing, but if you're already putting eye drops in to lower the intraocular eye pressure, you're going to have to be watching it because you don't want to lower it too low. So you have to work with your ophthalmologist to make sure that they can adjust, if you're taking a pharmaceutical for it, the pharmaceutical, and knock it down to where it's at lower or eventually eliminated completely levels. Macular degeneration, wet and dry. Once again, as we improve it, if you're on any medication for it, you're going to want to get off it. And we've seen amazing results with macular degeneration, whether it's wet or dry macular degeneration. Now, of the things I'm going to tell you, it's very important to understand that if things have developed so far where it's, I use the expression always when I lecture, it's too late. You waited too long. It's so bad, nothing can reverse it. Okay? Well, prevent it from getting worse. That's always a first goal with some of these conditions that we see, and any disease that we talk about. Prevent it from getting worse. Then you don't know whether you can reverse it or not, or how much you can reverse it until you try. Better to have tried and failed than never to have tried at all. Otherwise, you're automatically have failed. Patients have come to me and told me many years ago, my floaters are gone. Really? They didn't come to me for floaters, but their floaters were gone. Then I noticed my floaters were gone. Go figure. A lot of people suffer from dry eye. Again, people don't come to me for dry eye, for help, but dry eye suddenly is gone. Conjunctivitis, allergic and environmental conjunctivitis, chemically induced conjunctivitis is something we've seen tremendous help for. In terms of infectious conjunctivitis, now, if the infection is caused by a virus, yes, what we're going to tell you can be amazing to treat it. If it's bacterial, which is typical, what they often call pink eye, generally speaking, you're going to wind up in an ER or an urgent care center where they're going to give you drops to put in, antibiotic drops. And in my practice, I have never seen an acute case of pink eye come walking in. So you might benefit by going to an urgent care center or an ER right away to get treated for pink eye. So and we're going to talk about arterial blockage in a minute in more detail. So what's the main thing that I've seen help these things? While patients sometimes come in and have all these conditions, they may be coming to me for other reasons. We have seen nothing but tremendous success in stopping progression and in eliminating it and reversing it in all these conditions that I've just mentioned with intravenous ozone therapy. Now, if you listen to my show called Intravenous Ozone Therapy, Everything You Need to Know, you'll learn there's 8 different methods of intravenous ozone therapy. The only method that seems to really work on all these conditions is the simplest of them all. Okay, the direct IV method in my version of it, RMDIV, Robbins method, direct intravenous ozone therapy. There is no set average, typical, or usual number of treatments to stop progression and fix these problems. Though I will say, even if you do the minimum of 3 or 4 treatments a week of the direct IV method, none of the blood methods, not the saline methods of ozone therapy that are very commonly found now here in the U.S. and around the world, is the ideal way to go for eye problems. The direct IV method, where we push the gas directly into the veins, I've only done it over 375,000 times, probably more than any one clinic in the world, and probably, and certainly more than everybody that I've trained here in the USA that might be doing it, put together. So I've proven its benefits and its safety. So when you listen to the show, it goes over all those, that show on intravenous ozone therapy, it goes over the details. It's a 2 to 6 minute treatment. You need to do it at least 3 times a week, though more is better. More frequent treatments gets a faster result. It's just that simple. It's medicine. Ozone therapy done the way we're talking about it, medical ozone therapy, is just medicine. And normally, if you had a medical problem, like the ones we're talking about, you would take medicine for it every day. You'd be putting drops in or whatever every single day. And usually maybe even several times a day. Even just once a day treatment, 3 or 4 times a week, can fix these problems significantly and turn them around. Though if you're very bad, you may want to do more frequent treatments to have a bigger impact, because it's not a guided missile. You can't whisper into ozone's ear, go to the eye, leave every part of the body and all other virus, fungus, yeast, mold, bacteria, parasites, toxins, and harmful free radicals alone. It doesn't work that way. So more is better. And we don't put ozone directly into the eye. There's stories about some methods being used in Europe like that, and I have no experience with it, nor do I recommend it until we until there's more investigation to prove that it's safe and beneficial. But rectal insufflation, if you can't get to a doctor that does DIV, may be helpful here. This is an ozone enema. It takes 2 to 6 minutes. The direct IV method takes 2 to 6 minutes for treatment. But rectal insufflation takes maybe 10 minutes. You can do it morning and evening. You can get set up with it from Promo Life for a home care system. If you tell them you heard about it here on my show, they may even give you something off, a special deal. So don't hesitate to mention you heard it here. Don't hesitate to subscribe to my show as well, if you would. So ozone therapy, by the time I've done 36 to 48 treatments for these problems that I've said, I've seen unbelievable results take place in people. Again, they're coming in for other problems, but these are serious medical issues they have in conjunction with their other problems, and we've seen wonderful, wonderful results for them. I had a man that called me up when I was doing a radio show as a guest, and he had just gone blind in one eye, and now he was going blind in the other. He has other medical problems as well, so he came in the next day after hearing the show, apparently, and started treatment. Well, that day, the vision in the eye that was going blind came back fully. And within 3 treatments, he got his vision back in his other eye. This was an ozone miracle, I thought, as I call them. Though miracles should be few and far between, this was pretty amazing. So what happened? I found out later he was a man in his mid-70s, and he was having mini strokes all the time. So what I believed happened was a calcified plaque broke off and started to block the optic artery. So his eye wasn't getting the circulation that it needed. And this is what was causing temporary blindness in him. Now, ozone melts down calcified plaques. And with this melting down of the calcified plaques, his vision came back. Amazing. Now, because so much blood reaches the head, And in direct IV, it's all the ozone's in the blood, and all the other chemicals that are created are in the blood that melted down those plaques. A lot of blood reached the head and obviously melted the plaques down, and he was able to get his vision back. I have no other answer for why his vision came back other than that, and nobody that I've ever spoken to, and I've spoken to a number of ophthalmologists, has a better answer than that anyway. Now, in terms of prevention and treatment of eye problems, if you go to our National Library of Medicine, the NIH, the National Institute of Health, we have a National Library of Medicine called pubmed.gov. And if you go to search and you put in gut-eye axis, you're going to find out that there's about 190 papers, either directly or indirectly, talking about how the microbiome, the probiotics that are supposed to be in your gut, as well as bad bacteria, can communicate with your eye and affect your vision and eye problems. So it's very clear from reading these things, something that I've lectured on around the world and I've done many podcasts on. It's vital to have a healthy gut. So if you go, and that's where Doctor's Biome came in. Now, why not just say go out and get probiotics, which would be the easy thing for me to say and do? Well, if you've listened to my other podcasts on this, you're going to learn that capsule, powder, and tablet probiotics took living bacteria, living biome, and put it into suspended animation. They freeze-dried it, and it destroyed a lot of the healthy bacteria because they're very sensitive, and put it into suspended animation, as I call it, in a powdered form, which was then put into capsules or compressed with other things into tablets, or even just sold as a loose powder. Well, in any case, when you hydrate these bacterias, these freeze-dried bacterias, it's been discovered that over 80% to 90% or more are completely destroyed and will not come back to life. Those that can, some might come back to life, actually grow into healthy adults, and possibly reach the wall of your gut where they're needed, not just aid digestion. So you have to have the right number of strains. Doctor's Biome has 15 patented proprietary strains that are capable of surviving the stomach over 90% because they're next generation bacteria. But they're living to begin with in a 100% organic mint, kale, lettuce, celery, cucumber, apple, lemon juice. So it's delicious. So when you see children even with eye problems, you can even give it to children because it's safe and it's delicious. Okay? You need to take it every day because we destroy the biome every day. Listen to my shows on microbiome. You'll understand all about that. So you drink 1 2-ounce shot a day. Children, smaller doses, of course. They don't need a whole big bottle, though it's safe if they did drink it. It's 2-ounce shot, so it's not a big bottle. And by strengthening your gut's microbiome and putting only good boys back into the wall, they will communicate with your eye and improve your vision and help in the prevention as well as in the treatment of these eye problems. And like I said, there's over 190 papers on the gut-eye axis, so go look it up if you want. You don't have to just take my word for it, and start to read about the connection between the microbiome and the eye. Now, there's a whole bunch of supplements that you can take that are great for the prevention as well as for the treatment of eye problems. I don't give amounts out. Find it's inappropriate because everybody is of different size. Everybody has a different ability to absorb these things. People will buy crap versus high quality supplements, which makes a very big difference. You have to have a healthy gut to absorb all these nutrients. It's very important. So I try to avoid giving you amounts. You could try to figure that out yourself. Work with doctors who are into functional medicine, or now they're calling it precision medicine. And they can test you, and hopefully, if they know how, and give you the amounts and the frequency of taking these things. But I recommend these be taken on a daily basis. Vitamin A is great to help in preventing and help in supporting the retina and in preventing retina damage. Vitamin E is helpful along with vitamin to prevent cataracts, with vitamin D um, in helping in the prevention of and treatment of diabetic retinopathy. Vitamin C, oh, you've heard me do shows on it. I talk about it all the time on every show, 5 or 6 times a day. Remember, if you absorb a high quality vitamin C, like a liposomal vitamin C, um, if you absorb it well, it's only there for about 2 hours. Your body will use what it needs and urinate the rest away. So I say 5 or 6 doses a day of vitamin C is essential. These others, once a day is usually enough. I mean, vitamin A, you can take 5,000 units to 10,000 IUs, depends on your need. Vitamin E, 1,000 IUs of the mixed tocopherols, vitamin D3 along with K2. You could be taking 10,000 vitamin D, and I already told you I'm not going to give you amounts, but these things are pretty standard. Unfortunately, the only way you can really get glutathione, which is wonderful for the eye, is either you get intravenous glutathione or you combine by orally taking vitamin C, alpha lipoic acid, and N-acetylglycine, NAC, N-acetylcysteine, excuse me, N-acetylcysteine, NAC. Those 3 things, NAC, alpha lipoic acid, and vitamin C, help your body create glutathione, which is an important antioxidant for the eye. And it can help rid the eye of excess fluid if it happens to have excess fluid. Selenium and niacin for increased circulation to the eye. Riboflavin can decrease the risks of cataracts. Omega-3 and 6 fatty acids can decrease inflammation in the eye if you're having eye problems already. Acetyl-L-carnitine, lutein, and zeaxanthin are those 2 are carotenoids, help in macular degeneration. Ginkgo biloba and gotu kola, hawthorn berry for better circulation, along with cayenne pepper, ginger, and garlic can help with circulation to the eye. Bilberry and pine bark extract, which is called pycnogenol, grapeseed extract, very helpful in supporting circulation and supporting the capillaries to the eye, and they help lower the risk of glaucoma. Some Chinese herbs I've heard, I haven't had any experience with them. You need to see a doctor who's experienced with Chinese medicine. But I'm going to spell it because I can't pronounce it right. Diagaku eye drops. Diagaku eye drops. Are Chinese herbs that have been mixed, and I think they're readily available in a preparation that help in healing dry or inflamed eyes. Cacao helps in, dark chocolate. Always go for the highest amount of the cacao in it. Can help improve blood flow, so that helps in glaucoma and all sorts of problems, along with black currant for glaucoma. Those are just some of the, I know there's possibly some other things I didn't mention in terms of supplements that you can take to help with eye problems, the eye problems that we've been talking about. Now, if you happen to have a viral conjunctivitis, only intravenous ozone therapy is going to fix it because it destroys all viruses. But you need to support the immune system with a virus anyway. And the way to support the immune system along with vitamin C is the doctor's biome, because if you've had antibiotics and it kills all the good boys off almost instantly. Now, ozone kills the good boys in the gut off too, just not instantly like antibiotics. That's one of the reasons all my patients have to take doctor's biome. But if you've killed all the good boys off, or if you red meat or chicken or farm raised fish, a lot of people go for sushi, things like that. You're going to have these things. You're going to kill all the good boys off. I don't care if you burn the meat. So yeast overgrows in your gut. And if yeast is overgrowing in your gut, it can cause a host of medical problems. And you have to and one of the important things is that yeast is fought by the T cell portion of our immune system, which fights not only yeast, but fungus, mold, and viruses. So you have to get the yeast in balance again. And that's what doctor's biome does, and along with some rectal insufflation. So write all these things down. Also, make sure that you go to promolife.com. 888-742-3404 is their phone number. Tell them I sent you. In fact, that's the best way to get a discount. Call up, tell them I sent you, tell them you want to get set up for home care. Okay? 888-742-3404. And go to Doctor's Biome, DOCTORSBIOME.com. Put in the coupon code Howard35. You'll get 10% off the retail price, and tell all your friends they can use it as well. I don't mind giving it out. My patients all have it. And you'll get 10%. It's not a cheap product, but nothing cheap is good and nothing good is cheap. Okay? Is an expression for a reason. So, and capsule powders and tablets just don't work. Listen to my shows. I don't lie about anything. People learn that about me. I tell the truth about everything. I'd rather you smack me for telling the truth because you didn't like what I said than suffer the embarrassment of a lie at my age. So get yourself Doctor's Biome. Take a 2-ounce shot every day. I promise you won't be sorry. And it comes with a 100% money back guarantee anyway. What have you got to lose? You got absolutely nothing to lose, everything to gain. If you have any questions about this subject, you can call my office in Manhattan. They'll connect you to me, and that's 212-581-0101. That's 212-581-0101. Okay? You can email me at Ozone Doctor, OZONEDOCTOR, all spelled out, not DR. Ozone Doctor, DOCTOR, at yahoo.com. And you can email me a question. I also, as you know, I do online consultations at that, so you can email me there and tell me that you want to do one. Subscribe to my channel, please. I'm told by my techies that this is an important thing for you to do. Please do it. Please subscribe to this, to my channel. It's everything I do is free. I try to make myself, even in my fees in my office, I'm probably the most affordable ozone doctor in all of North America. So we try to make ourselves available to people, not just the wealthy and financial elite. So everybody, stay safe, stay healthy, stay well. Listen to all our podcasts, tell your friends about them, and thank you very much. Everybody, bye now.